The date was on the 19th of November. I had an automobile accident. I knew I was hurt, but I didn't know exactly where. Within about a week, I couldn't move anymore on my right side. I had some problems. The biggest thing was picking up the dogs, putting them on a table, and grooming them. And that was a point that I thought, gee, I might have to give up my hobby.
Joan was one of my spunkiest patients I probably had. Her passion was dog shows, and that's what she wanted to get back to. And not only did she have arthritis of the shoulder, but she also tore the rotator cuff tendons. And the normal ball and socket has smooth cartilage on the ends of the bone and moves smoothly. When you become arthritic, you lose that cartilage and you can have a bone-on-bone situation that's painful, and patients lose motion with that as well.
I wasn't able to show my dogs or groom my dogs, definitely not able to groom. Well, when you have an elbow and an arm, you're in constant misery, pain, and you can't do it. You know, it's just hopeless.
Patients in the hospital for usually anywhere from 1 to 3 days after surgery. When we do a shoulder replacement surgery, we remove that arthritic ball and put in a metal ball and a smooth plastic liner. So now you have smooth metal and smooth plastic articulating with each other. That takes away the pain. In addition, we remove the bone spurs, remove all the scar, and that gives the patient their function back. And
when I went to the physical therapist and to that facility, the only thing I could move in my right arm was my hand, back and forth, and that was it. And within 6 weeks, I was that high. You know, when you can lift your arm that high after 6 weeks from just going left and right, you know something's right. The surgery was right, it was done right, the physical therapy was right, and I did my part.
It's a comprehensive approach, it's a team approach. It begins in the office with preoperative education for both the patients and the family. It continues as we come to the hospital, working with the anesthesia team to really minimize the amount of pain after surgery and maximize their comfort in the whole surgical process, and carries on through with nurses and therapists here on the floor.
If they told me to jump, I did it. If they told me to bend, I did it. And I didn't mind doing it because I could see as the time went on, I was gradually getting better.
I've had patients come in a week after surgery and said, you know, Doc, this is the first time I've slept through the night in this past week. The week after surgery is the first time I've slept through the night in months or years. And it's really satisfying, really why we went into orthopedics.
Knowing I can pick up things and put them down, and know I can dress myself again. So that means a great deal of me to be independent, and I am. And I do everything I want to do now. I show my dogs, I groom my dogs, I care for my dogs, I care for my puppies. When I went back to judge, and I put my hands around a big Doberman, and I didn't feel any pain. And I said, I'm back to normal.
As her other side became problematic, she came back and had her other side done, and both sides have done quite well, and she's back to showing dogs and is very happy with her outcomes.
I don't know if he has another patient that's done it twice, but you know, if I had a third arm, I'd go back the third time too.